Hello. Today we're going to talk about something incredibly important, melanoma. My goal here is to walk you through what it is, who's at risk, and most importantly, what you should be looking for. Let's just think of this as a straightforward conversation, the kind you'd have with your own doctor. So let's get right into it. So first things first, let's zoom out and look at the big picture. What are we actually talking about when we say melanoma? And why does it get taken so seriously? This part is really the foundation for everything else. Let's start with a number that really puts this into perspective. For men here in the United States, the lifetime risk of developing invasive melanoma is 1 in 27. For women, it's a bit lower, around 1 in 40. The point is, this isn't some super rare disease. It's something that affects a lot of families, which makes being aware of it absolutely key. So, what is it exactly? Well, to put it simply, melanoma is a cancer that starts in your melanocytes. You can think of these cells as the tiny pigment factories in your skin that give it color. And here's the crucial part. While other skin cancers are technically more common, melanoma is the one that's responsible for the most deaths. That's why it demands our respect and our attention. This, of course, brings us to the question everyone asks. Could this happen to me? So let's talk about your personal risk. We're going to break down the key factors that can make someone more likely to develop melanoma. Your risk is really a mix of your genetics, the cards you were dealt, and your personal history. A big one is family history. If melanoma runs in your family, that's a major flag. Then there's your skin type. People with fair skin that burns easily, red hair, light eyes, they have less natural protection. Having a lot of moles, say more than 50, also plays a role. And then we have the lifestyle factors, and these are huge. A history of really bad blistering sunburns, especially when you were a kid, and any use of indoor tanning beds. That concentrated UV exposure is just incredibly damaging. And I want to clear up a common misconception right here. It's not just about how much sun you've gotten over your whole life. The pattern of that exposure is what's really critical. All the research shows that it's the intermittent, intense exposure, getting a terrible sunburn on a weekend trip or on vacation, that's more strongly linked to melanoma. Those sudden, high-powered blasts of UV can just overwhelm your skin's repair mechanisms. Okay, now we get to the most practical, most empowering part of our conversation. When it comes to melanoma, early detection changes everything. So the question is, how can you be your own best advocate? How can you spot it? All right, this is your essential toolkit. It's called the ABCDEs, and it's a simple checklist for any spot on your skin. So, A is for asymmetry. If you drew a line down the middle, the two halves wouldn't match. B is for border. You're looking for edges that are uneven, blurry, or notched. C is for color. A normal mole is usually one solid color. A warning sign is having multiple shades of brown, black, or even patches of red or blue. D is for diameter. Anything bigger than a pencil eraser should be looked at. And finally, E for evolving. This is honestly the most important one. Any mole that changes, in size, shape, color, any change at all, is the one you need to get checked out. And if the ABCDEs feel like a lot to remember, here's an even simpler concept. Just look for the ugly duckling. Most of your moles probably look kind of similar, right? They're like a little family. If you have one spot that just looks different from all the others, it's an outlier. That's the one that needs a closer look, even if it doesn't tick all the other boxes. Trust your gut on this one. Okay, so let's say you've done a self-check and you found something that's making you a little nervous. What happens now? I know the idea of going to the doctor can cause some anxiety, so let's just walk through exactly what you can expect. The whole process is very methodical. First, your doctor will just take a look with their own eyes. Next, they'll almost certainly use something called a dermatoscope. It's basically a special magnifying glass with a light that lets them see structures just below the surface of the skin. It really helps them see what's going on. If the spot still looks suspicious after that, the next step is a biopsy. That just means a tiny sample of the skin is taken and sent to a lab to be analyzed by a specialist. It's a simple procedure, and it's the only way to know for sure. Now, when that lab report comes back, the single most critical piece of information on it is something called the Breslow's thickness or Breslow depth. All that means is it's a measurement, in millimeters, of how deep the melanoma has grown into the skin. And the rule here is incredibly simple. Thinner is better. The thinner the melanoma, the better the outcome. This is exactly why we talk so much about catching it early. So if a diagnosis is confirmed, what does the path forward look like? How is melanoma actually treated? And this is where that measurement we just talked about, that Breslow depth, really determines the game plan. I mean, just look at this chart for a second. It tells the whole story better than I ever could. When we catch melanoma at its absolute earliest stage, when it's just on the surface of the skin, The 5-year survival rate is over 99%. It's basically curable. But if it's not found until it has already spread to other parts of the body, that number drops all the way down to around 30%. The difference is just staggering. It all comes down to timing. And here's the best news. For the vast, vast majority of melanomas that are caught early, the treatment is a simple surgical procedure right in the office. The spot is removed, along with a little bit of healthy skin around it, just to be safe. And in most of those cases, that's it. That's the cure. But what if it is caught late? Well, even here, the story has completely changed in the last 10 years. We are in a brand new era. We now have things like targeted therapies, which are smart drugs that can actually go after specific mutations inside the cancer cells themselves. And even more exciting, we have immunotherapies. These are treatments that basically take the brakes off of your body's own immune system, unleashing it to find and destroy the cancer. These have been absolute game changers for patients with advanced melanoma. So, we've gone through the risks, the warning signs, and just how powerful early detection is. You have all the information now. So the only real question left is the one right here on the screen. Thank you for listening.